Hi, my name is Fallon Jordan, Brain Ambassador for Aiming University, and today I'm going to talk about one of my favorite things, which is how Brain SPECT Imaging helps distinguish between post-traumatic stress disorder and traumatic brain injury. And as someone who had both, and I did not know that I had both, I knew that I'd had multiple concussions, but I had no idea that I had PTSD until I got my brain scan. And the patterns that were shown made it very clear that I had concussions, but I also had some significant emotional trauma and distress. And it was just so amazing to see that picture. And in our Overcome Anxiety, Depression, Trauma, and Grief course, Dr. Amen actually goes over different examples of what these scans would look like so that you can have more information and start seeing things through a new lens. A lot of post-traumatic stress disorder and concussion or traumatic brain injury symptoms overlap, such as trouble sitting still, having anger outbursts, having panic, being obsessive, needing to control your environment, having episodes where you are experiencing memory loss or dissociation. And so it's really important to start looking at absolutely everything that we can so that people are getting the most informed health for them. One of the things that's quite scary is that someone who has been diagnosed with PTSD, if they go to a traditional doctor who does not understand the importance of holistic care and focusing on brain health, they are very likely to be given benzodiazepines, such as like Xanax, Klonopin, Valium, and they may also be giving antipsychotics if they're having anxiety and anger outburst where they are having some type of mania. And those types of medications actually damage the brain. And the parts of the brain right here, the temporal lobes that are not working already because of the brain injuries that haven't been taken care of, they're actually making these parts of the brain that are working bad work even worse. So it's really important to really understand how delicate our brain is and how some of the most safe holistic options are actually the best things for addressing concussion repair and PTSD. And these are things that are outlined in the course. And if you can go to brainhealthassessment.com to learn more about your brain type and start supplements, because supplements and EMDR therapy, hypnotherapy, bioidentical hormone replacement, hyperbaric oxygen therapy, all of these things are incredibly valuable when you are recovering from TBI and PTSD. And I can say that because I am one of our best success stories. And if I can do it, then I know that you can do it. And even if you or someone you care about is not suffering with these, again, just having this information and knowing how much value you're bringing to the world, because you never know whose life you can change just by going to the grocery store. So I hope that this is helpful. As always, please email us support@Amen University if you have any questions. And we look forward to seeing you again next week.